Welcome. My name is Kimberly Pryslak. I'm the clinical director here at Medi, Tresse, New York, and I'd like to welcome you to our virtual hair restoration event. At the end of the webinar, there'll be a live question and answer, and I will get to as many questions and do my best to answer as many as possible. I also wanted to inform you that if you sign up for a consultation within 48 hours of our webinar and decide to do a Painless PRP, you will receive $500 off your initial series of 3. In addition, for joining us this evening, we'll enter you into a giveaway where 3 attendees will receive a complimentary scalp exfoliation treatment or 2 complimentary products from our hairline. Here at Medi Tresse, we do an extensive consultation, and that includes scalp examination. It includes trichoscopy with hair metrics, which is AI for the hair, extensive blood work looking at hormones and different nutrients that are important for the hair. What we do here is, and this is really important to understand, is in dermatology, which is very visual, hair is very auditory. It's about listening to the patient. And I go back as far as I need to in order to understand the hair timeline. And I think this is an important concept, is getting to the root cause of the problem. Some of the contributing factors to hair loss, basically there are 2 categories of hair loss. We have scarring and non-scarring. And non-scarring, we deal with more of the genetics, the nutrition, inflammation. Also, with autoimmune issues, I think these, there's 2 large categories, but we deal with most all of them and looking at the root cause of the problem. PRP here at Medi Tresse, we specialize in PRP. We do what's called optimal platelet concentration. And this is really important to understand, is every time you have a PRP, we have a platelet counter, which kind of personalizes your PRP for you based on your platelet count. And I think that's super important. Our hair is extremely metabolic. It requires high levels of stem cells and growth factors. So I think that this is an important concept. There's 2 ways of administering the PRP. We have a painless, and we also have the standard injections. When it comes to PRP, I think it's so important to work with a medical provider and someone who really understands PRP. I think that in most hair losses, PRP can be used, but I think it needs to be used in circumstances that are really appropriate, making sure your blood work is checked, making sure that you're not shedding extensively. I think that PRP can work in most alopecias. I feel that hair is so important, hair hormones, getting an understanding of what's causing your hair loss. And I think that's why Medi Tresse can stand out and be your provider. It's more of a journey. I feel I like to work with patients and develop a relationship, and I think that's so important. Thank you for attending. I want to mention that all giveaway winners will be notified by email. I also would like to point out that at the end of the webinar, you will receive a text. If you're interested in scheduling a consultation, please reply back and someone will contact you to schedule an appointment. I'd like to invite you to all stick around for the next 15 to 20 minutes while I try to answer some of your questions. I'd like to thank everyone for joining us this evening, and I'd like to answer some questions. And I'll start with, this is a great question. I get this one a lot. Is blood work always drawn prior to a PRP treatment? And what separates Medi Tresse from other med spas and other services in addition to PRP? And I think this is so important. You know, in a consultation, it takes time. It takes listening. It's about really understanding what's happening to the hair. I feel the patients give us the diagnosis. That's the bottom line. If we listen, we can make the diagnosis. Blood work is an adjunct. I feel that when you're doing PRP or you're doing high level stimulation, it's very important to make sure that all your boxes are checked and that we, doing our due diligence and making sure that everything is right for you to get your hair back, for sure. Next question. Does PRP cause initial shedding? It can. And the hair's transitioning during this time. Particularly, PRP usually have to do 3 treatments 1 month apart. And this is important because it's kind of like, I call it like a loading dose. And that loading dose, during that time, your hair is transitioning. And I think that I always say, it's increasing that anagen phase. It's keeping that hair in the growth phase. And unfortunately, in the beginning, sometimes you have some loss particularly in order to continue the process. But I do believe that you can definitely have some shedding, unfortunately. But in the end, it's out with the bad and in with the good. I have read that PRP can cause hair to shed. Oh, sorry, it's the same question. How do you determine the cause of hair loss? And this goes into more extensive into the examination. Trichoscopy is very, very important in our practice. I feel that we use something called the hairmetrics, which helps us to really get to looking at the scalp, looking at the vasculature of the scalp, looking at what's happening. Sometimes we only see what's on the surface, but trichoscopy can give us a really in-depth look. I use all my senses when I'm examining. As soon as the patient walks in the room, I'm starting to examine them. Are they kind of styling their hair a certain way? Can I see their hair loss? Also, it's about feeling the texture of the hair. Does it feel right? Does the scalp look right? There's so many components, but in that 1 hour during our consultation, I use everything at that moment to help determine the cause of their hair loss. If PRP is not the right treatment option, what other options are there? And I think this is a great question. There are definitely in hair loss, there are definitely different medical treatments. And I see so many women that go down the rabbit hole of not evident, evidence-based is so important. There's no evidence in a lot of things we do. Here at Medi Tresse, we take pride in all the products, everything we offer has evidence behind it. And I think that's like one thing that I'm so proud of, that, and, it's unfortunate that social media and everything gets kind of, takes people to a different level. But I do believe, I think that, medical treatment and getting to the root of the problem is so, so important. And, blood work and trichoscopy and examination are all a part of that. How does painless PRP stimulate hair growth? So painless PRP is obviously something that we've been doing for a few years here at Medi Tresse, and it's an interesting kind of concept. That it uses hydraulic pressure through a jet peel system, and it breaks through the pore, and that gets the PRP into the scalp without obviously a needle. We have, in the end, the results are very similar to injection. There's no downtime, which is great. There's no, you can basically, I almost call it like a lunchtime PRP. You can have your PRP and actually, return to work and not having downtime at all, which I think is a great, great, way of treatment. Is PRP painful? We know here we do a ring block. I also use some topical. I take my time, and I feel that can relieve some of the anxiety. I believe in doing a standard injectable PRP. The next day you can have some discomfort, but then you're going back to your normal, work routine. You wash your hair the next day. So the downtime is minimal. But again, if the pain is very subjective in many ways. So I usually talk to a woman about pain or discomfort more one-on-one, and I can help to understand where where they're coming from. But I believe that giving a good, nice ring block and using a topical, you can have almost a very comfortable PRP. Just a few more questions. How does the shedding compare to minoxidil? I'm assuming this is comparing it to PRP. Minoxidil shedding is very different from PRP shedding. Now, minoxidil, what it will do is it takes the hair from the telogen phase and basically sheds it. So it truly is out with the bad in with the good. So you're transitioning your hair. It's a little bit different because it's all your hair. When we do PRP, we're doing it on specific areas on the scalp. So those areas are affected, but minoxidil doesn't say, okay, just get the top of the hair or the back. So it's going to be more of a global shed. And that's where I feel the shedding is a little bit different. With PRP, I mean, you get some shedding, but it's just transitioning that area, where minoxidil is more of that, quote unquote, dread shed. I don't really see it that way because I don't dread the fact that, I'm going to have great hair in the end. And the anagen phase, you just want to always prolong that anagen phase. And that's so important in the cycling of hair and understanding the cycle. I did get a question. Do we see patients under the age of 17? And I do with their parents. I feel that this is, they need support. Young women with hair loss, it's such an emotional component. The psychological aspect of it, I think some young women that I see in the practice, they don't want to socialize. They don't want to go out. I feel it breaks my heart sometimes. And I feel that they need the support of their family and they need the support of their parents at that time. And I do encourage them to come with their parents to the consultation. What are some of the most common causes of hair loss? I get this question a lot. And, there's two huge categories, scarring and non-scarring, and what we do is, in genetic hair loss is non-scarring. It's probably, in many years, it was always the common, androgenetic female pattern, very common. Now I'm seeing a lot more autoimmune, a lot more scarring alopecias. And I think that's when the experts need to come in, particularly with scarring. Scarring is a very difficult alopecia. And I think they're, again, talking about the emotional, component. Some women, it's very difficult to get their hair back. But early treatment, early diagnosis is the key. I think wasting so much time on things that aren't known to work or aren't, treatments or first line, second line, third line, I feel like you waste a lot of time. And here, I feel that, the diagnosis can be made through even biopsy. If a woman really wants to know, I'll biopsy and we'll get the diagnosis down and treat, appropriately. And, after seeing hair for many, many years, I feel like, biopsy is something that I like to do and I do when I need it, but diagnosis with a trichoscopy can be done very easily. What does it matter if I wait to start treatment? To me, waiting, most women have waited already. By the time they get here, I feel that when you've lost about 30% of your hair, that's when you start to feel your hair is thinning. So you're already kind of behind. To me, it's like hair and time go hand in hand. The longer you wait, the harder it is to get back. And I think that that's so important. Start treatment early. Start treatment before, you're shedding, or you have, a family member that has hair loss and you feel like you have a similar pattern. Don't wait. I feel like you want to get your hair back. It's going to take some time. Your hair doesn't respond immediately to treatment. Everything lags behind a little bit with hair. And that's why I think that getting the correct treatment and treating it up front pretty aggressively can get your hair back, and you can have your hair. And so treatment, I start sooner or later. I always feel we're behind the eight ball in some respect, that I believe that starting, usually when a woman comes in, they should have started treatment sometimes even years before. Okay. Once I start minoxidil, do I have to take it for life, or is there a cutoff? Yes. This is so important. This is a question I probably get every single day of my life. Yes. With genetic hair loss, this is important for female pattern hair loss, is the key here is it's not curable, but treatable. Okay. And I do say this a lot. And when you're starting minoxidil, I use this every day. I say, well, do you stop brushing your teeth? You say, I'm not going to brush my teeth today. I feel like I've done it too long, and why am I continuing it? I use the same kind of concept with minoxidil. It's, if you want your hair, if you want to continue the anagen, that growth process, that growth phase, I think it's so important that, yes, unfortunately, minoxidil is going to be a part. Although I think the future of hair is going to be very different in the next 5-10 years. There's going to be new studies coming out, new looks, looking at the DNA of the hair and how can we replicate it. But right now, minoxidil's been around since 1970. It's proved itself since then. So unless you have side effects, I do believe it becomes a lifelong process. Other alopecias, telogen effluvium being one of them. I do work with a lot of patients. If other modes of stimulation can be brought in, and I have weaned them off, although that's not the standard of care, but that is something I do try to get them off if they want to. I mean, I work with everyone. Everyone is an individual, and that's here where I feel we personalize your treatment to you. And I think that that's what's really important here. And once I start women on, I do tell them, you may have to take this for the rest of your life. And if they say, no, then we try, you can do laser. Low light laser is also a great way of stimulating, keeping that hair in the anagen phase. And I love laser. I really do. With PRP, it's the ultimate in rejuvenation. Instead of the minoxidil pill, is there a spot treatment? I ask because I now have hair growing everywhere. Very common, very, very common side effect of minoxidil. You can, it depends upon the spot. If you wanted to, we could talk about this, offline, but I do spot treatments on certain areas. Sometimes it's working with kind of looking at what works for you. I can use a very low dose oral, and then if certain areas are a little stubborn, I will apply a topical in those areas. I feel that you can get a little bang for your buck of doing both. But it's an individual. Some women don't have any, excessive hair, but that is one of the side effects. So, it's unfortunate but it is a real side effect, and it can affect your life, unfortunately. Electrolysis, dermaplaning, we go over a lot of these things, but I feel that, the side effects, risk and benefit is something that we always, in medicine, we're always looking at. But I make sure up front that we know some of the risks. You can lower the dose. Sometimes that will, alleviate some of the hair, and all the other, modes of removing hair is also a part of it. I think I've answered all the questions. So you'll be contacted by email. You'll be contacted, and the gift baskets and the discount off the PRP. I look forward to working with you. I look forward to making your journey, your hair loss journey. I like to partner with you, is what I truly believe. This is about you and me figuring out what works for you. And I love, and it's my passion. And I look forward to meeting all of you. And thank you so much for joining us tonight.